Mr. Adesina Adetunbosun, founder, Babajide Oloudala Foundation, a sickle cell NGO, has advised sickle cell patients to keep warm and avoid extreme temperature in the management of sickle cell during Harmattan. Adetunbosun gave the advice in an interview with newsmen on Tuesday in Abuja. He said that cold and extreme temperatures could increase sickling and trigger painful event. He said extreme temperatures such as dry, cold, and dusty winds associated with Harmattan season affects sickle cell anemia patients, thereby triggering crises in them. Adetunbosun explained that sickle cell anemia, also known as sickle disorder or sickle cell disease, is a common genetic condition due to a hemoglobin disorder inherited from both parents. He said sickle cell is associated with a number of acute and chronic health problems such as infections, attacks of severe pain, sickle cell crisis, and stroke, with an increased risk of death. Sickle cell warriors must maintain cleanliness and dress in layers of clothes, as cold temperature and unhealthy environment could trigger episodes of pain, fatigue, and frequent infections. There is need for them to drink plenty of water to avoid dehydration, a balanced diet and dietary supplement to help keep their body immune system strong. It is important for them to stay healthy as possible, which means eating healthy foods and vegetables as well as getting enough sleep. People with sickle cell anemia do not have enough normal red blood cells, which leads to frequent fatigue, hence the need for adequate rest. Read, Ministry partners with SFH to combat HIV and AIDS in education sector. Children with the condition can play and exercise, but should not get too tired, too hot, or too cold, and should avoid activities that leave them excessively exhausted, he advised. He said severe childhood infection could be prevented by getting them fully immunized as well as maintaining personal and environmental hygiene at all times. Adetunbosun stated that getting the right nutrition on a daily basis would further help warriors reach their full growth potential. He cautioned sickle cell warriors on excessive consumption of alcohol and cigarette, warning that alcohol consumption can lead to dehydration while cigarette smoke could reduce the amount of oxygen in the bloodstream. Besides, he urged parents and guardians to acquire knowledge in managing the condition at home, thereby recognizing serious symptoms and when to seek medical care for severe pain.